We need more. Those are the words constantly being touted by healthcare professionals at the front lines here and across the globe. Joining us now is Dr. Darian Sutton, who's an emergency room physician here in New York City. Doctor, thanks so much for joining us.
Hi, good evening. How are you?
I am well, hanging in there as all of us are. So let's get straight to it. Do you and your hospital have what you need in terms of personal protective equipment or PPE? I mean, how prepared is your hospital?
So the answer is no. The amount of N95 masks that have been circulated, unfortunately, are simply just not enough. We're finding that we're using N95 masks on a weekly basis when they normally are used for one patient interaction. So we're already at the point where we're stretching our resources.
Now, we haven't hit the worst of it yet. I mean, hospitals are already saying that they're out of equipment. Are systems just not set up for scenarios like the one that we're facing?
So that's a great question. We often set up for emergency events, such as mass casualty incidents. Every ER is set up in a way where we can facilitate. But this is a situation where we're going through a mass casualty incident every single day. A lot of people will reference other prior infections or outbreaks, such as SARS in 2003. But the simple reality is that this pandemic of the COVID-19 virus far outweighs the effects of such viruses such as SARS. So it's a simple reality that we just did not have the capacity to store the amount necessary to treat this many people.
Now, some doctors in Italy have warned over the weekend that they were growing concerned that hospitals were becoming a place of transmission back into communities. Is that something that we should be thinking about? And what's your advice to patients who want to go to hospitals in New York who don't have COVID issues?
Yeah, so I hear that, and I will say as a physician, I'm always concerned about that. We've made precautions in many different ERs that I've spoken to my colleagues around New York City. We've tried to establish zones where we have patients who are high risk for the likely diagnosis of COVID-19, and other zones for patients who have other emergencies like strokes, heart attacks, other issues that are happening still, regardless of this infection. The reality is that as time goes on, everyone is going to be exposed. We're trying our best. But what I would say to people who are coming into the emergency room is really ask yourself whether or not you need to be there, and realize that you're stepping into a place that has a high risk of exposure to COVID-19 if you don't already have it. So what I like to inform people is utilize other resources like telehealth and urgent care, or even calling the ER and talking about your symptoms to a nurse or a provider, and you probably be better equipped to understand what you're getting into.
Tell us a little bit about the types of cases that you're seeing, especially when it comes to young people who, as we saw over the weekend, some of them seem to think that they're immune.
Yeah, and I have to say that I thought the same. I thought the same when I was looking at the initial data and statistics that were coming from China. I thought that this was a disease that was really just limited to those who are over 60 or those who had chronic conditions. But the reality is that I'm not seeing that. I'm seeing with patients coming in their 30s to 40s who are requiring significant interventions, requiring oxygen and intubations, and having significant pneumonias that are making them symptomatic. I can say that from the reports, as far as the CDC goes, the mortality outcomes are still very low for those under the age of 40. But we're still doing these procedures and interventions that are needed for these people who are, in my mind, young and should never really be in the ER.
Now, a point that can't be stressed enough is the need for social distancing and flattening the curve. We keep hearing that, right? But are there levels to this? Is going out for a leisurely run something that people should be avoiding at this point? I saw a bunch of people at Central Park on Friday, kind of squished together on park benches. People are still going out and they're still kind of in close proximity to each other.
Yeah, so I would inform people, first off, the definition of social distancing is that you want to basically retain your family unit. So that means that if you live within a small space with your roommates, for example, it doesn't mean that you should invite another apartment over, because that, in effect, is inviting two family units together. And that's inappropriate if you're trying to follow the rules of social distancing. As far as going out for a run, I think that's completely okay. However, if you notice that you're in a space of a high population density, you need to find an exit and get out, because you're going to be exposed inevitably. Or if you have asymptomatic COVID, you're going to expose someone else vulnerable. So what I try to inform people is stay safe, be aware of the surroundings around you, and if some place is crowded, avoid it.
Dr. Sutton, thank you so much for your time and your insight. We really appreciate that.
Of course. Thank you so much, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.